What's going on, everybody? This is Big Joe, and this is number 2 of our educational series. And this one's going to be about detox. What does drug and alcohol detox look like? Now, there's really just 2 different kinds of detox. There's medical and there's non-medical. Medical detox is really geared towards our benzos and our alcohol. If someone is abusing Xanax, Valium, for a long period of time, they have been drinking for a long period of time, they really need to go to a medical detox. Now, I'm not a doctor, and I'm not trying to give medical advice, but I have been in the addiction field for quite some time, and anyone that has been drinking or using benzos for a long period of time, there is a very, very high risk of stroke and heart attack when they're detoxing. Please don't let them do it on their own. Please don't think you can bring them to your house and let them sweat it out on the couch. That's really not going to be the best thing for them, and the medical risk of death or injury is very, very high. So, on the detox side, I highly suggest if someone is detoxing from benzos or alcohol that they seek medical attention, hospital, ER, a medical detox. Please go and get some help. Don't try to do this on your own. Now, most people think, I get a lot of calls, people reaching out to me needing help, and they all want to go to a medical detox. Now, if you're detoxing from anything but benzos or alcohol, you really don't need to go to a medical detox. You can go to a regular detox, non-medical. They're still going to give you comfort meds. You're still going to be made to feel as comfortable as you can, but you have to remember that your body is detoxifying from a foreign substance that you have been putting into it for whatever reason, and it's trying to push it out. Yes, it's going to be uncomfortable. Yes, there's going to be vomiting. Yes, there's going to be diarrhea. Yes, there's going to be body aches. There's going to be all these things, and for a few days, you're going to feel real bad. But just know that you don't always have to go to a medical detox. I see so many people that don't go into treatment or don't get help is because they're scared of the detox. They're scared of the pain, and they can't find a medical detox that will take them. I'm here to tell you today, and we're going to go through some drugs here on this board, and which ones need medical detox, which ones don't, and, maybe the length. How long is this detox is going to last? When is it going to peak? What's the duration? When's it going to start? I have so many moms and dads and husband and wives that reach out to me every day, and they have these questions. So that's the whole point behind these videos, is to educate you on when is the detox going to start, when is it going to peak, and when am I going to start seeing my loved one start acting just a little bit normal. Now we're going to dive right into this. Now the first drug we're going to talk about is going to be benzos. Now that's benzodiazepam. That's your Xanax. One of the worst prescription medications that I've seen someone detox from is benzos. Now I've got 5 different drugs here on the board. Of course, I know there's so many more. There's a laundry list of different substances people are abusing. Like some I do not have on the board are inhalants. Flaca, crocodile, meth is not on here. These are the most common ones that we see all across America, no matter age, gender, race, geographical location. These are your main ones we see people abusing, and that's the reason why I picked these top 5. In my humble opinion, these are the top 5 drugs that just about anybody in America knows somebody that's using one, if not all of these. So, benzos. That's the street name for benzodiazepam. Now, the detox on benzos, once again, this is a drug that needs to be medically detoxed. It's going to start in about 1 to 4 days. It all really depends on how long someone's been using it and how much they're using it. Depends on when is the detox going to start. So you're looking at the detox to start about 1 to 4 days. Now it's going to peak. Now what I mean by peak is that's when you're going to start seeing the worst part of the detox. You're going to start seeing that in about 2 weeks. Now these are not exact numbers. These are not set in stone, but around the 2-week mark, you're going to start seeing the peak of the detox. Now, why is it 2 weeks? Why is it taking so long to see the peak? Benzos, Benzodiazepines, Xanax really affect the brain. It's meant, it's made for depression, anxiety, and a laundry list of other, mental health ailments. So it's really affecting the brain. It really digs deep into the body, and it takes a while for it to start breaking loose and detoxing from. So you're going to see the peak in about 2 weeks. Now, the duration of the detox from benzos can be months to a year. Now, I know that sounds crazy and everything else, but the detox can be from months to a year until that person starts clearing the fog from them, until they really start, you start seeing that person you love come back to you. Now we're going to move down to heroin. Now, just about everybody in America has heard about the heroin epidemic, the opiate epidemic. It's all across the nation. It's in other countries. And we really got to focus in on this, and that's the reason why it's number 2 on the board. Now, heroin is a drug that does not need to be medically detoxed. You do not have to medically detox off heroin. You can go to a regular detox. You can go to a regular treatment center. They will give you comfort meds. They will make sure that you are safe, but you do not need to go to a medical detox. Now, detox on heroin is going to start in about 12 hours. That's really when it's going to start hitting. You're going to feel the body aches. You're going to start feeling horrible. The cravings are going to kick in. That's going to happen with heroin in about 12 hours. Now, you will see the peak on heroin in about 24 to 48 hours. Now, I know you're probably asking, why is it so different between benzos and heroin? Benzos is 2 weeks. Heroin is 24 to 48 hours on the peak. Heroin has a shorter shelf life in the body. It's not a prescription medication. It does not have a time released like most of your benzos do. So it comes and goes. That's the reason why we see people using anywhere from 4 to 10 times a day. And it gets in and out of the body quick. So 24 to 48 hours on the peak. The duration of the detox from heroin can be weeks to months. And what I mean by duration is it's when the fog clears. It's when they start coming back to normal, whatever that looks like. But a whole lot less than benzos. So once again, heroin, the detox is going to start in 12 hours. The peak's going to be 24 to 48. And the duration is going to be weeks to months. Now let's move down to pain medication. Now we've all known someone that has been prescribed pain medication for a back surgery, knee, elbow, shoulder, having your teeth pulled. I'm not talking about that. What I'm talking about is someone that has rather been prescribed or is illegally using pain medication for 6 months to a year or longer. Now once again, these detoxes and how long they're going to last and how severe they're going to be all depends on the length of usage and what is the amount they're using on a daily basis. You got to take that into consideration. How long have they been using this substance? How many months, years, weeks, however long that is, and how much are they using? And the longer the bigger those numbers get, the more severe the detox. So now with pain medication, it's going to start in 8 to 12 hours. Once again, it has a short shelf life in the body. Nothing like benzos. Pain medication will start in 8 to 12 hours of last usage. The peak will be 12 to 48 hours. And the duration is going to be 5 to 10 days. Now, that's a whole lot less than the other two that we've talked about. Pain medication, your duration is only 5 to 10 days on detox. Versus the other two, heroin, weeks to months, benzos, months to year. So pain pills they are still a severe detox. They do not need medical detox. It can be ran through a treatment center or just a normal detox, clinic, but does not need a medical detox and has a much, much shorter detox compared to the other two drugs. Now let's move down to alcohol. Alcohol does need a medical detox. Once again, the only two on this board that must have a medical detox for your safety and everyone else's that's around you is benzos and alcohol. Once again, I am not a doctor, but I have been doing this for a very long time. And if someone calls me and says they're using benzos or alcohol, I've got to get you to an ER or a medical detox as fast as possible. So now with alcohol, detox is going to start in about 8 hours. After they sober up, they've had that last drink, in about 8 hours, that's when they're going to start feeling bad. That's when detox is going to start. Alcohol detox will peak in 24 to 72 hours. Now, the reason there's a variance in all these numbers, like I said, is because it all depends on how long and how much they've been drinking. If you got a loved one that's been drinking for 10 years and they're drinking a fifth to a gallon a day, that peak is going to hit in 24 hours. Now, if they haven't been drinking that, they don't drink that much and they ain't been drinking that long, it'll probably go closer to the 72-hour mark. But every person is different. Everybody's body is different. Everybody's going to detox differently. Everybody's going to act differently. That's why I highly suggest if you are abusing drugs or alcohol that you please go to a detox, whether medical or non-medical, and please at least seek 30 days treatment for your substance abuse or alcoholic issues. It's going to be the safest environment. You're going to get the most out of it, and you're going to set yourself up for success. And that is the whole reason behind all these videos, is to educate you and hopefully in an effort to set you up for success in becoming the person you deserve to be. Now, once again, with alcohol, it does need a medical detox. The detox will start in about 8 hours. It will peak from 24 to 72 hours. And the duration will be a couple weeks. The duration of the detox will be a couple weeks. The fog will clear, and we'll start seeing some level of normalcy from your loved one. Now, the last drug we're going to talk about today is going to be cocaine. Now, cocaine is pretty much going to be one of the easiest substances to detox from. Does not need a medical detox. But still, please go to a detox. Please go to treatment. Please seek medical advice. Now, the detox from cocaine is going to start in hours. You know, it could be 1, 2, 3, 4, but you're going to start detoxing from cocaine in a whole lot shorter amount of time than any of these other substances. Cocaine gets out of your body quicker than just about any other substance on this board. Now, you're going to start detoxing in a couple hours. It's going to peak in a day or two, a couple days. A couple days, you're going to be in the peak of the detox. And the duration of that detox is going to be 1 to 10 weeks. So it's, you know, the detox from alcohol on the duration side is probably a little bit shorter than cocaine. It's definitely, pain medication is a whole lot shorter than cocaine. But still, cocaine, you do not need a medical detox. Now, this is just a real quick breakdown on 5 different, mostly abused drugs that I see on a daily basis. Once again, please seek medical advice. Please go to a medical or non-medical detox. Please don't try to detox and do this on your own. We cannot do it by ourselves. We must have help. I've tried it for so many years doing it by myself, and I always failed until I went to detox treatment and had a little help from the courts. I ain't gonna lie. But guys, this is just real quick, a short breakdown on any of this. If you have any questions or you would like to know more, hit me up in the comments. They're right down below. I hope this has been educational. I hope you check out the other videos that are to come. There's one before this one, and that was on what is the intervention and assessment part of trying to find treatment for your loved one. This is the next step, which is detox. It always starts with the intervention and assessment. Then you go into detox, and we're going to keep going until we get to all the stages of inpatient treatment that your loved one, I hope, goes through if they're abusing any of these drugs or any other drugs they're getting off the street or from your doctor. So guys, I really, really appreciate you all watching these. I hope you share them. I hope this has helped you. I hope you can show it to someone and it can help them. This is Big Joe, Recovery Champions. I love every single one of you. If you need help, reach out, and I always will love you. Have a good day.